So my role here in the primary care team is a nurse care coordinator. What we do is we track patients with multiple chronic conditions, and we follow them once they've been admitted to the hospital and they transition home. We also follow patients who get transitioned from a hospital over to a rehab or a skilled nursing facility. What our responsibility is to, with those transitional patients, we will make sure that they have the proper follow-up that is needed, that they understand their chronic conditions, that we also book any other follow-up appointments with specialists as needed, and then to go through their medications and reconcile their medications. We also follow a multitude of patients who have more than 2 chronic conditions on our chronic care management program. And what our responsibility there is, we will touch these patients at least at minimum 1 to 2 times a month. We set goals with these patients to teach them and to educate them on their medications, their chronic conditions. And the whole emphasis is to keep these patients from overutilizing the ER or being admitted to the hospital, ultimately readmitted to the hospital. So the age of patients can vary. So typically, because we work with chronic conditions, most of our patients are 65 years and older. However, we follow anybody with any chronic condition. So if a primary care doctor feels that a patient is complicated and requires our services, they can refer any patient to us. We don't just follow patients that get admitted to a hospital or a rehab. If there's any needs that are high risk or complicated situations, a primary care physician can refer any patient of any age. Most of our job is typically over the phone, but if any complication arises or if we feel like we're not getting through to them, we can certainly have them come into the office to see us face to face. So the great thing about here at CORE is we are a part of the team, and I always felt like care coordination was the best term in my mind, is that we close the loop of communication. So we're a part of the primary care team. We also work very closely with the VNAs, the rehabs in the area. We work very closely with the palliative care team in the Exeter Hospital. We work closely with the case managers. We're really integrated very well in the whole, across the continuum, I would say. So it's not just the providers, it's really everybody. One thing that I can say working for CORE and why somebody should consider to work from here is that they really do value their nurses and they value us as nurse care coordinators. Anything that we've needed to advance this program, which is every year developing better and better, that they are willing and they work with us very closely so we can expand this program. So I feel that CORE values their nurses and they're willing to give us the support and the resources that we need to do our job better and better.